Commissioner Ulrich and commissioners, I'm just going to mostly focus on vaccinations today, although I'll give you a little bit of an update of where Scott County is at as far as cases. Today, as of actually last night, we're looking at about, 11,318 positive cases in Scott County, which is about an increase of 377 from the previous week. We're still at a lower on the way down, which is nice. It's nice to not see 4-digit numbers these days. That number is actually a little bit higher than actual for the week because there was some corrections made to our database with some individuals on our east side of our county that were mislabeled as Dakota County when they were technically in our county. So we are still seeing a decline in number of cases, and we're really happy to see that. 2020 was, I heard earlier, a difficult year, and we are starting to see the light at the end of that tunnel for this year as we roll out our vaccination campaign. Next slide, please. So just a quick reminder, there are two types of vaccines available for the state of Minnesota. They have the Pfizer vaccine and the Moderna. Most of the Pfizer vaccine went to hospital-based care. And for Scott County Local Public Health, we are focusing on just the Moderna vaccine. Both are very effective vaccines, and both adhere to the safety standards and protocols that are required. For the Scott County vaccinations, for the Moderna, it's 2 doses. It's between 24 and 28 days apart. And we will be doing vaccines for people 18 and above. They are continuing to test it on lower ages, but right now it's only approved through the emergency use authorization for 18 and above. We are not requiring vaccines. The state of Minnesota is not requiring vaccines. It's strictly, they're not requiring them. It's strictly voluntary. Next slide. And another reminder for the public, we are getting a lot of phone calls on when vaccines will be available for them. The state of Minnesota is rolling out the vaccines based on a variety of factors, most of which that weigh quite heavily is the most at risk for negative impact, serious illness, as well as those that have been disproportionately affected, as well as balancing equity and transparency. Next slide. It is a phased approach to vaccine. We are currently focusing on 1A, which is those healthcare workers, emergency medical services, et cetera. I have another slide that lays it out a little bit further. But right now, the state of Minnesota is very focused on 1A. We have not moved yet to the next phase, and haven't received detailed guidance on the remaining phases. But this will be a phased approach. The community, when we get to open vaccinations for the entire community, that's like at the very end, and you see that in phase number 2. Next slide. So this is how it's being rolled out here in Scott County, and I hope that's big enough for you to read now. Phase 1A is on the far left column, and the general public you see at the very far right column at the bottom. So we have quite a few groups that we are targeting in between now and then, and balancing with our current availability of vaccine. So phase 1A, far left, is really those mission critical. So those that are responding to the current pandemic, hospitals, the vaccinators. Our vaccinators were done last week. Skilled nursing facilities where we're seeing a lot of cases, a lot of outbreaks, a lot of death among the seniors and at-risk individuals. Anybody who is working EMR, emergency medical responders, that includes like our local city police and fire. Clinics that are not part of a healthcare system, so Park Nicollet, Alina, those types of that would be an affiliated clinic. So the ones that fall in there are those that are not affiliated with those, so that don't have access elsewhere, are freestanding dialysis centers. We will be done with this group by the end of this week.
Good.
Wow.
And then we will start moving to group homes, long-term care, the adult foster care. So places that, congregate living facilities where people can't just get up and go to a clinic or go get out to get vaccine, or don't have access elsewhere. The individuals in these homes, for example, I think we have like 45 licensed group homes, multiple adult foster cares, home care agencies. This doesn't mean that local public health has to go to every single one of these locations to do vaccines. What we are currently working on is gathering lists of these individuals, making connections with them, and really identifying if they have access to vaccine elsewhere. All of our skilled nursing facilities are part of you'll see PPP in there. That's the pharmacy partnership program, where pharmacies have agreed to go to the skilled nursing facilities and help them do their vaccinations. Many of our assisted living facilities have also made connections with some pharmacies. We had about 4 that had not, and we reached out to a local or a regional pharmacy who agreed to do their vaccinations for them. And so out of all the assisted living facilities, local public health will really be only going out to about 5 to assist them with their vaccinations. So it is time consuming, but it's really about creating those partnerships in the community, and local public health's role is to fill in that gap where they aren't, if they're not currently covered. So next week, we'll be starting to roll out those congregant living facility locations. So it's going to be a while before we get there. Assisted or essential workers would be in the next phase. That's a huge group of people. That includes teachers and childcare staff. Just teachers and school personnel alone is about it's over 3,000 people in Scott County. So we'll be rolling out, working with the schools to figure out the best way to deliver those vaccines. So as you can see, there's a variety of different groups. It's going to be very time consuming, and we also have to balance that with the amount of vaccine that we have. Next slide. So our current status, our current allocation is 300 vaccines per week. We've received 2 allocations of this so far, so we only have 600 vaccinations to date. We are hoping that increases soon, because it will take us quite a long time just to even do the teachers if we're only getting 300 vaccines per week. I mentioned already the skilled nursing, they're covered. We did our community vaccinators last week. We did 21 vaccinations. We had 0 report of any serious adverse reaction for any of them. Sore arm, which is typical. That was heard for most of my staff and myself. It was quite sore, just for a couple of days. But no fever, no reaction whatsoever, so that was really positive. So we will be doing this week. We have 3 clinics set up, one in the south in Belle Plaine, one in Prior Lake, and one in Shakopee. And this is going to cover our emergency medical services. So the city, police, and fire, our unaffiliated clinics have been invited to that, on our dialysis center located down in Belle Plaine, I believe it is, has also been invited. And for those that are unable to come this week, we have put aside another day next week just to ensure that we want to get our folks covered, and they'll come to us on that case. We decided to go out to 3 different locations, doing a push strategy, because if we only did Shakopee, it's quite time consuming for a police officer from Elko Newmarket to drive all the way to Shakopee to get his vaccinations, and we really want to keep these folks in the field. Next slide. So currently, I think I mentioned this already, we're just really working through 1A. Because we're only getting vaccines at 300 doses per week, we thankfully, actually, I mean, it's both some positive and negative, but it's helping us spend time working with these locations and trying to figure out where they can access vaccines, and identify really who just really doesn't have that capacity elsewhere. And the focus right now, EMS, we're really almost done that group. So our direction from MDH is when we have finished 1A1, we're okay to move forward to 1A2 and 1A3 and just really get them done. I think we're pretty fortunate in our county that we have such good partnerships, and we may end up moving a little bit faster through these groups than a larger community or those that just don't have access. So we will be moving to 1A2 by next week.
Lisa, just a question here, if I might. Is there any kind of reallocation procedure? Let's say you don't have enough, but some other organization has too much vaccine. In other words, is there a way to redistribute to those that don't have enough?
There is a redistribution process that's also part of our partnerships for those, and it's if we had too much, and I don't think we won't get to that point in the near future, Commissioner Ulrich. But one of the things that we have access to, for example, our unaffiliated clinic, we could allocate if they wanted to do their own vaccines. They can't order because right now the vaccine is only available in lots of 100, and our unaffiliated clinic only needed like 15. So they would not be receiving a lot of 100 for their 15 individuals. So if they weren't coming to us, they were provided an option of us reallocating 15 of our doses, which when I say our doses, it's really Scott County doses. So we could reallocate 15 of the vaccine that we have to them to enable them to vaccinate themselves. As far as reallocating among other counties, that's not yet available. I do recall, though, during H1N1, there was a lot of sharing of vaccines, particularly between the hospitals and local public health. It was just the way the vaccine rolled out and current needs. So there was a lot of back and forth at that time. The benefit of the Moderna vaccine is it's a lot easier to transport than the Pfizer, because the Pfizer had to be kept at -75, and the Moderna vaccine is we can keep that in standard coolers. So when we get to that point, if we need to, we will be able to. Next slide. So we'll just continue working with our target populations as vaccine becomes available, and we will work our way through 1A. We cannot move forward to 1B until MDH does give us the go-ahead. But right now we are just working down that chart that you saw until we finish them all and get to 1B. I apologize for that. It really is it's just going to be a matter of time and patience. Right now, again, we don't know when they're going to start increasing our allocation. But when we get the vaccine, we'll be giving out the vaccine. So we are planning this week for next week and for the week after. We will, once we get to the larger groups, we'll be doing, when we get to the community vaccination groups, we'll be doing a larger type of full-scale planning where we would have a lot of support and hopefully running, maybe 300-400 people at a time through our vaccination clinics. Right now, these are very small, or most of them are small targeted vaccination clinics. Next slide. I think that was it. Commissioners, is there any other questions that I can answer for you today?
Mr. Chair, I got a question here for Lisa. How are we doing with people taking the vaccine in our own county? I mean, staff-wise, and also all of the businesses and hospitals and folks, are they readily accepting it? I've heard in some counties in California, like many of them, less than 50%. What are you seeing out in the field?
Commissioner Beer, it's a little early to answer that question as far as what the vaccines that we're doing. I can tell you that we have a lot of people signed up for the clinic this week. In one jurisdiction, I think 25 out of the 40 that qualified for the vaccine signed up. And in some cases, for the 15 that didn't, it was not because they were anti-vaccination, but most of them were either they had access elsewhere or they were just on leave that week. We do have a few that aren't going to get the shot. As we move forward, I can provide that data. I do know, I saw a statistic yesterday. I think we have about 1,200 people in the county that have already received the vaccination, and that's probably those that are, they're hospital-based and healthcare-based. We have had a lot of emails and communication from there's a. We haven't gotten to those levels yet, but even in those, like in 1A, 1C, 1B, a lot of emails about people wanting the vaccination and wanting to know, are anxious for us to get to their priority levels so they can get the vaccination. I would guess we're going to get, if I had a crystal ball, I would say about 50 to 60% will eventually be interested in getting the vaccination. And we can provide that information as we go along.
Yeah, it's just more of a curiosity, and then a follow-up question, if I may. And I have not really done a ton of research on this, but what do you have to say to folks that may or may not? Now, I'm not talking about political reasons, but I know there's folks that are anti-vax. I try to research that when we gave our kids those vaccines, which we did. Not this one, but haven't had the chance. Some of the things, like here's a question for you. I know you have a son, I believe, but I have a daughter who is 17. Would you have her take the vaccine?
I would recommend the vaccine for anybody that would be at risk. We know science indicates we need about a 70% immunity rate to reach that herd immunity, which will be important to get over this. So right now, though, a 17-year-old is not approved for the vaccine that we get, but she could get the Pfizer. For my own children, even the ones that have already had COVID, I have recommended to them that they should get the vaccine as soon as it's available. So it is recommended for those, even though if they've tested positive.
Interesting.
Mr. Chairman?
Yes.
Thank you, Mr. Chairman. Lisa, first of all, I had two things to say, but you've talked about herd immunity, and I just, tongue-in-cheek, I got to tell you, I used that phrase the other day, and somebody said, call it community immunity. But it might have been the setting I was in where herd might have been taken a little more literally. Okay, tongue out of cheek. Let me just say two serious things. First of all, a question you may not be able to answer now, but I'd be curious is to know about the community effectiveness of the vaccines. We see a positivity rate of X, whatever it is. Will we be testing people that have had the vaccine just to be sure that it's working, that they're not continuing to test positive, or do you anticipate we'll see a drop in the infection rate, those so-called cases that we hear about? That's my first question. If you can't answer it now and we need to wait a couple weeks, I'm happy to do that. But know that inquiring minds think about that. And then I have just a comment. Sometimes over the years, you and I have differed over the mission of public health and what we're doing and why we're doing it and so on. But from this commissioner's perspective, what you're doing right now in planning for and dispersing the vaccines and making sure that the most vulnerable are reached and the most necessary citizens are vaccinated first. To my way of thinking, that is your sweet spot. You're doing exactly what this commissioner thinks is the number one primo reason for public health exists. So I just want to commend you on the report and on obviously the thoughtful planning that's gone into the rollout as the vaccines have become available. And just kudos. I want to offer a commendation to you for doing that. Thank you.
Thank you, Commissioner Beard. And it looks like with the palm tree in the background, you are somewhere warm. So I commend you for being able to escape our frozen tundra here.
Well, go ahead. We've escaped a couple things. One is it's Florida, And the state is wide open. Nothing is shut down. Everybody's asked to wear a mask in the distance. But the level of public angst and intensity is much less down here than it is up there. But that's a political comment. I probably shouldn't even make it. But yes, it is slightly warmer, and I'm grateful for that.
To answer your first question, Commissioner Beard, as far as community effectiveness, I mean, we know the vaccine from scientific evidence is 95% effective. It's been very well tested. I mean, especially with our skilled nursing facilities, we have had so many outbreaks and so many deaths in our skilled nursing facilities, and which drives up our numbers. And intuitively, as we get immunity for those community immunity in the skilled nursing facilities, we should start seeing less cases in that population. And that's another reason why they were, put up right near the front. We've had a lot of cases, and in Scott County as well, of healthcare workers that have contacted COVID. So intuitively, we should start seeing less cases. And we already are seeing less cases now. I suspect it's due to some of the restrictions in the new emergency, or in the executive order, really focusing and targeting on places that were driving up our numbers where there was a lot of community spread. So I'm very, very hopeful. And we do know, schools are back in session around January 18th, so we have a little window here to try and get as many people vaccinated as possible between that. So logically speaking, I mean, we did see this during H1N1 as well. As vaccination became available, we had less cases.
Good. Thank you. Thanks, Lisa.
Thank you.
Any other questions? Well, Lisa, thank you for all your work. I know Commissioner Beard already thanked you, but I want to thank you as well. I know that this whole time period has got to have been an exhausting time period for you and your staff, and long hours and working around the clock and high alert. And so thank you for all that you're doing and will do. We really appreciate it.
Thank you, Commissioner Ulrich. I have to just want to commend my staff who've been really working tirelessly, getting the job done. It does take a full team, and I have great staff. We've had some really good support from the EOC, the Emergency Operations Center, and this really couldn't have been done without the support of the county and the staff and the community as well. We really see just so many positive stories and strengths in our community that will have a lot of stories in the future. So thank you, everybody. Be well, stay safe.
Thank you.
You too. Thank you.
Take care.